Whenever lying down, to help straighten your knee after surgery, prop your heel on a pillow and keep your toes pointed straight up. But don't put any pillows behind your knee. When sitting in a chair, put your heel on the seat of another chair, keeping your toe pointed straight up. You or a family member can then gently push on your leg to help straighten it. Once your incision heals, you can lay on your stomach on a bed with your lower leg hanging off the edge. You need to get your knee to bend, even if it feels tight from the swelling. Sit on a chair with your knee bent and your foot flat on the floor. Gradually move your buttocks forward on the seat without moving your foot. You may need to use a table leg to help keep your foot from moving forward. Some people find it easier to find a stairway where you can support yourself with a wall, doorway, or the rail. Place your surgery foot onto a step and gradually lean forward, bending your knee. Rock your knee slowly until well bent.
Performing these exercises is an integral part of your recovery. Your goal is to slowly work up to 20 repetitions of each exercise. Strengthening the muscles that were weakened during surgery will help you to return to normal activity and promote healing. Doing these exercises is your responsibility. Your determination ultimately controls the function of your knee.
The best formal exercise for after surgery is deep breathing. Breathe through your nose, lifting both arms overhead at the same time. Breathe out through your mouth, lowering both arms at the same time. The next exercise is a gluteal set. Squeeze your buttocks together and hold for 5 seconds, and then relax the muscles. The next exercise is a quad set. Lie on your back with a small towel rolled under the knee that was operated on. Press the back of your knee into the rolled towel and hold for 5 seconds, and then relax the muscles. The next exercise is an ankle circle. Lying on your back, slowly move your ankle that is on the same side as your knee surgery in a circular motion. The next exercise is a straight leg raise. Lie on your back with the leg that was operated on straight out and the opposite leg bent. Tighten your top thigh muscle and raise the leg that was operated on. You may need assistance with this exercise at first. The next exercise is a terminal knee extension. Lie on your back. Place a large towel wrapped around a coffee can under the knee that was operated on. Straighten the knee that was operated on so that the foot rises up. The final exercise is knee range of motion. Sitting on a chair or bench, place a small rolled towel under the knee that was operated on so that the thigh is parallel to the floor. Straighten the knee that was operated on as far as you can and hold this position. Bend your knee as far as you can and hold this position. The goal is to be able to get your knee straight and to bend to 95 degrees or more. 2 to 3 days after surgery is discharge day. At home, you'll need to faithfully do your exercises on your own 3 to 4 times per day. Realize that life may not be so easy at first. You may want to get some help from family members or friends for a time. But you should do as much as you can by yourself because this speeds your recovery. As with any major surgery, there are some precautions you will need to follow to avoid damaging your knee. Those include: resume normal activity slowly. No routine running, jogging, or jumping. Don't lift more than 40 pounds. If you must kneel, pad hard surfaces, but check with your surgeon first. Never kneel and then sit back up on your heels. Follow all directions for infection control. Use your walker or crutches until told not to do so, usually for 2 to 3 weeks. You can walk, bike, hike, swim, golf as much as you would like as long as you can do so safely without falling or getting hurt. Your recovery will take from 6 to 8 weeks, although you may be able to go back to more normal activity after 4 to 6 weeks. Your surgeon will determine when you are ready after your follow-up appointment. How quickly you recover is dependent on how well you follow your recovery plan. But if you do, you can feel confident that your new knee will provide years of comfortable living.
So far I've been able to walk a little better, and I'm getting better with the exercising. I'm getting my legs straighter, and I don't have the pain. It's a little sore and touchy yet, but that is nothing. I mean, when I'm walking, I have to stop to rest because this knee hurts more than the one that's just been operated on.
I have another knee to do, so we're looking forward to that. Actually, it was the left knee that caused me the trouble at first. Then with medication, it somewhat took care of the pain. Didn't solve the problem, but took care of the pain. Then the right knee acted, it was the same way, bone on bone, and with the bone chips, then it got bad.
You can walk better and everything and enjoy life. Hey, there's a lot to do, and I'm a very active person, and to be sitting in a chair, hey, that's not me. So I wish that I'd done it sooner. And I tell anybody, go ahead and do it.
Like I said, at first I had my doubts and my scares and my worries and problems like that. But now that I've had it, I'm glad I did it, because it's only going to get better. And I already, with my physical therapist, have been walking with just a cane and not the walker. And to me, that was quite a goal. And this is what I'm looking forward to, that I'll maybe someday not have to walk with the cane at all. But right now, with this foot being, or this leg being longer than this one, I know I need that little bit of support. But I am going to have my other leg done right after Christmas.